Black. I am a member of SNAFA, the Student National Pharmaceutical Association, which is the organization that focuses on serving the underserved. As co-chair of Remember the Ribbon, it is my duty to educate, advocate, and support people and patients who are affected by HIV. Today, I have the pleasure of interviewing our very own Dr. Newsome of UT Tyler Fish College of Pharmacy.
Hi everybody, I'm Dr. Jonathan Newsome. I'm a clinical associate professor here at UT Tyler Fish College of Pharmacy. Graduated from Pharmaceutical in 2008, and I've been teaching now going on 11 years.
All right, thank you very much for that. So my first question to you, Dr. Newsome. So we know that there are different types of pharmacy settings. There's inpatient and outpatient clinics, hospitals, and retail pharmacy. Can you describe to us what was or is your setting when it comes to you treating HIV patients?
So typically my setting has been outpatient, and my main job has been doing more medication reviews for the patients, not only to ensure that they're on optimal therapy to treat their HIV, but also make sure they don't have any drug-drug interactions. That is a very common thing that you see with HIV patients that can get ignored, is that a lot of times they have other medications for other conditions that can interact with their regimens. And so that was one of my big things. And then also, we also will look at their heart disease risk, since a lot of HIV patients, or if you have HIV, you have a higher risk for heart disease compared to somebody without.
I commend you, Dr. Newsome, for sure, for being that hero for that population who definitely needs someone. So what would you say is missing when it comes to working directly with HIV patients, or what do you think as a society we could do to aid them in their journey?
I'll probably say the biggest thing that's missing is access and knowledge of care. A lot of the patients that I've worked with in the past have not been very educated on where they can get resources to help manage their HIV, whether it be their medications, whether it be as far as non-pharm, so like healthy living things. They just haven't been aware of where they can go to find those resources or get those resources.
So we've talked earlier about the license, the AAHIVP. Can you explain a little bit more about the difference between having that credential and then just regularly treating those patients as a regular pharmacist?
Well, I would say that having that credential provides you with kind of two things. One, it gives you more credibility, instant credibility, I would say amongst your peers and with those patients, because it demonstrates that not only do you have the knowledge, the working knowledge to treat and help treat those patients, but it shows that you have the experience, that you have worked with HIV patients for a certain amount of time and have dedicated a certain amount of hours to providing care.
Dr. Newsome, thank you again for meeting with me and sharing your insight. I'm pretty sure our audience and other student pharmacists will take away so much stuff from just this interview. So I want to thank you again.
Thank you.